As an interventional cardiologist, we work mainly on the arteries of the heart. Number one priority is to make sure the arteries are open and flowing. In the setting of a heart attack, which is a blockage in the blood flow, our job is to take very small wires and take very small stents and prop open the arteries, restoring blood flow, hopefully alleviating symptoms and reducing any effects of a heart attack. When a patient comes in complaining of chest pain, one of the first things we want to look at is to make sure they're not having an acute MI or a heart attack. That is defined as a lack of blood flow to the heart. We do EKGs, we check blood pressure, we look at the patient, we talk to them, try to get a good history. By the time your blood test comes back that tells us, hey, there may or may not be some damage to the heart, we don't want to waste precious minutes. So an ER physician will come and talk to you right away. You'll get an EKG within 5 to 10 minutes of walking through that ER door. If there's significant abnormalities or your symptoms are worrisome, a cardiologist will get called, and then at that time we can evaluate yourself as well as an EKG. The initial diagnosis of coronary artery disease, or CAD, which leads to chest pain and heart attack, is sometimes very difficult to make. Sometimes in women and diabetics, they don't get the classic, there's an elephant on my chest type of pain. So we do a lot of screening tests. One of them might be a treadmill test where you run on a treadmill and we see how you feel and what your heart's doing based on an EKG. There are different types of stress tests. One is a nuclear stress test, mainly for people who cannot walk or exercise. And it looks for a lack of blood flow in one of the thirds of the heart. One of the new screening tools we have here at San Ramon Medical Center is a coronary artery calcium score. That is essentially a CT scan of the chest looking for calcium. When you get plaque in your arteries, the body tends to try and stabilize that plaque by depositing calcium in there. And that's the calcium that we can detect. If there's a high degree of calcification in the artery, the assumption is that you have significant plaque in there. Now, a little bit of calcium is okay, but if it's past a certain set point, then we have to be very worried that you have some cholesterol plaque. That does not mean that you're going to have a heart attack or you're going to need a stent, but that means you should be very cautious with your diet and your exercise and go talk to your primary care doctor or even see your cardiologist. San Ramon Regional Medical Center is really a local hospital. And as such, the people who work here live in this community. Some people were born in this hospital. Some people have children who are born in this hospital. So they take a lot of pride in this hospital. So you work a little bit harder when it's in your own backyard and you have a smile and you know the patients, you know the people, they're in your community. At a larger hospital, you might have a chance of getting lost. But here, it's really much more like a family. The advantage of having a heart team means you have lots of ideas and not one person has their one predominant specialty. Sometimes a surgeon may feel he can open up the artery, and sometimes a cardiologist can feel like I can open up the artery. When we get together, we really try to make a decision what's best for the patient, not what's I can do it or you can do it. So it's not really who's stronger, who's better, but really what's going to make the patient feel better and live longer. So here at San Ramon Medical Center, we're very lucky to have one of the newest cath labs in the entire Bay Area. We have the latest tools, the latest tricks available to us. Our cath lab is actually a half OR and a half cath lab, which means that we work very closely with our cardiac surgeons, with our ER physicians, with our pulmonary care doctors, and our primary care doctors to make sure that everybody's involved and the care is really well coordinated with a heart team. So it's not one doctor making decisions, it's a true team making the decision.
San Ramon Regional Medical Center is your community built on care.